Good morning, everyone, and welcome to my YouTube channel. This is Germinal Van, author of three major books, all available on Amazon.com. There is a fourth one currently in motion, and it is set for publication sometimes in late 2019. I will tell you the date in another video. But today, the monologue I'm going to deliver to you is about the problem of socialized medicine and the single payer system. And this monologue is divided in three major parts. The first part is about the debate regarding if healthcare is a right or a privilege. The second part is regarding the raise of the price of healthcare in the United States. And the third part is about the single payer system itself, so Medicare-For-All. Is it a good idea or a disastrous one? So let's start with the first one. Is healthcare a right or a privilege? I must admit to you that I personally used to believe that it was a right because of the moral case. We all heard that there are many people who cannot afford healthcare because it's too expensive. There are people dying in the street because they can't afford it. There are millions of Americans who are out of health insurance. It's not right. It's inconceivable. We must do something for them. I mean, it sounds fair. I have to admit it. And I even used to support that myself. But then I educated myself about the topic, about the subject. I've um, I've listened to interviews with intellectuals about this subject. I've read books and articles that were explaining the core, the substance of medical care in the United States. And medical care is not a right in this country. No, it's not. What is a right? Every society has two forms of rights. You have negative rights and positive rights. Negative rights are this set of rights that the government cannot deprive you of. The right to life, the right to liberty, the right to property. These three sets of rights encompass what we call negative rights. So the Bill of Rights to the United States Constitution, the 10th First Amendment to the United States Constitution are negative rights. The right to free speech, the right to bear firearms, the right to uh, protect yourself against government intrusion into your property, the right to not be subjected to cruel punishment, the right to a fair, speedy trial, the right to know your accusers, the right to not incriminate yourself. All these are negative rights. The government can only enforce these rights for you, but the government cannot deprive you of them. You cannot be deprived of. However, positive rights are rights that the government gives to you. So it means that it can also take it away from you. So the right to affordable housing, the right to affordable healthcare, the right to affordable education, all these are positive rights. It means that the government gets to decide how they're going to give it to you and under what terms and condition you're going to enjoy these rights. Is that freedom? No. And that is one of the quintessential reasons why healthcare has never been written in the Constitution of the United States. That's why it has never been written anywhere in this document that it is the role of the government to take care of its citizens medically. It has never been written anywhere. So no, healthcare is not a right. The founders knew very well. They knew that they did not want the government to decide what kind of healthcare everyone should get, because health is a personal matter. So the one in the situation of healthcare should decide what kind of medical care he needs for himself. So, ladies and gentlemen, healthcare is not a right, it is a privilege. It is a privilege because since it is based on private insurers, to have that you need to have income, and to have income you need to work somehow. You need to generate income somehow in order to afford healthcare in the United States. So the one that who works hard understand the value of healthcare, and that is a privilege. The one who values something understand the privilege of that thing he values. Now let's come to the second part of this monologue, which is the raise of the price of healthcare in the United States. Many says that every developed country or industrial country has a form of universal healthcare. So people can go and get medical attention and so on, except the United States, which is true. And in the United States, healthcare is very expensive, which is also a fact that cannot be denied. But why? Because healthcare expenditures are subsidized by a third party. And that third party is your employer. So you, the employee, the ordinary citizen, do not pay for healthcare right out of your pocket. Your employer pays for you. And the way that payment is made is based on tax deductible, so known also as tax exemption. But that tax exemption has two effects on the raise of the price of healthcare in the United States. The first effect is that it makes the employee more reliable, more dependent on its employer. But the double-edged sword in that situation is that the employee cannot make direct arrangement between himself and his private insurer, because the third party, which is the employer, is the one that makes the arrangement between your health care and the private insurer you're getting your medical care from. So because your employer is basically an entity, so your entity has the financial capital to pay for your medical care. So the private insurer, on the other hand, will raise the price of its services because the patient doesn't pay healthcare directly from his own pocket, but by a third party. And the second effect is that the employee takes a substantial fraction of his remuneration annually from his income on medical care compared to any other expenditures. So because that fraction is so large, private insurers get to keep rising the price of their healthcare services. That is why healthcare is expensive in this country. Now the third part, which is the most interesting, is Medicare-For-All. Our lovely Bernie Sanders, who has been championing Medicare-For-All for quite a while now. I don't even know when, but I know it was a central idea of his campaign in 2016, and he's back at it again in 2020. But it's a disastrous idea, let me tell you that. It's a fallacious plan. Simply because, as I said early in the monologue, we do not want government to tell us what kind of healthcare we need. The government doesn't know. Bureaucrats do not know what every single individual is going through. What Medicare for All means is that government will be the one subsidizing healthcare in the United States. Kamala Harris wants to get rid of private insurers and want government to have control of all the prices of medical programs in the US. So it means that people will have access to healthcare, sure, but at what cost? They're going to lower the cost of medical care, but the quality of the service will be terrible. It will drive doctors out of business, out of medicine, and hospitals out of business too. There will be no incentive because resources will be limited. You cannot have both. You cannot have a service that is cheap and provide excellent service. You cannot have both. Either the service is cheap and it has terrible performance, or the service is expensive but you are completely satisfied with the quality that it gives you. It's one of the other. And Medicare-For-All goes for the cheap part. So it's cheap, but the service will not be good. And on top of that, Medicare-For-All, according to the Mercator Center in George Mason University, will cost $32 trillion within the first 10 years of its implementation, if it were to be implemented. So everybody will go to the hospital, but what Bernie left out is the example of the NHS, or the National Health Services in England. This service is basically Medicare-For-All in England, so the government controls the price and the means of production in the healthcare system in England. So at first it worked fine, and then it was disastrous. So English have to even hire doctors from Pakistan because they had a shortage of doctors, a shortage of nurses, and administrative fees were lower, but people have to wait in line for very long. Some patients could not even be seen until 6 months, but if they have a critical and chronic condition, they're gonna die because the waiting lists are too long. That's a problem with socialized medicine. That's a problem especially with the single payer system. It limits incentives. It's going to drive hospitals out of business. Doctors will be paid by the government, so which means that there will be no incentive for them to do a better job anyway. Resources will be limited, and everyone is going to pay the damages when it will go wrong. So Medicare-For-All, it's a terrible idea. It sounds good on paper. It sounds good for the one that wants to remain in that delusive mindset of that, oh, the government is the one's going to give me salvation. No. Absolutely not. There are ways to reduce the price of healthcare in the United States. And this is something that has to be decided between the patient itself and his private insurer on the premiums. There are always arrangements that could be made that will lower the cost of healthcare for each individual. But collectively, it's impossible. You want to give government the power to decide for your health? Know that you're shooting yourself in the foot, because government will make terrible decisions for you. Government doesn't know how to allocate resources adequately for everyone. Those who will benefit from Medicare-For-All, once again, are Bernie Sanders himself and all the bureaucrats in government. But you, the individual, will not benefit from it at all. So healthcare should remain private. It should be privatized. Let competition take over the market. Let hospitals compete with each other. Competition forces competitors to upgrade and to update the quality of services. It gives incentive for people to do better. Medicare-For-All will simply disincentivize everything. It will disincentivize doctors, it will disincentivize hospitals, it will even disincentivize patients itself. So ladies and gentlemen, that was my monologue about the problem of socialized medicine and the single payer system in the United States. Please don't forget to subscribe to my YouTube channel and hit the like button if you like, or comment if you didn't like. I'm open for criticism, and I'm also open for debate. So it will be a great opportunity to see the point of view of everyone. Thank you very much, and have a good weekend.